MEDITECH empowers healthcare organizations around the globe to expand their vision of what's possible with Expanse, the intelligent EHR platform. Expanse answers the demands of an overburdened workforce with personalized workflows, interoperable systems, and innovative AI applications, all working together to drive better patient outcomes. Discover why healthcare organizations of all types and sizes choose Expanse to meet the challenges of the new era in healthcare. Visit ehr.meditech.com to learn more. I'm Bill Russell, creator of This Week Health, where our mission is to transform healthcare one connection at a time. This is an executive interview, quick, powerful conversations with leaders driving change. So let's get started. I'm excited to be joined by some leadership from DCH, Billy Helmandollar, CIO, and Faith Burkett, Chief Clinical Information Officer. Welcome to the show, you guys.
Thanks. We're glad to be here.
We were just joking. I mean, so DCH, your flagship hospital's in Tuscaloosa. So you're in the heart of Alabama. And Faith, you're a visitor in the heart of Alabama. And I hope I don't give it away here. It sounds like everybody does know that you're an Auburn grad who lives in Tuscaloosa.
Yes, unfortunately, but I'm proud to be here. I'm not an Alabama hater. So my husband's an Alabama fan. So, I'm in good company here.
What's your background? How'd you get there?
So I started out in nursing. I worked in critical care and neonatal intensive care and PACU. And then around 2017, I made the transition into informatics. And that's really where I found my passion. I get to combine my nursing background with technology. And I really love that I'm able to make an impact on patient safety and quality of care.
I've heard that similar story over and over again of people who have made that transition, and they like the impact that they can have across the entire board. Billy, I don't have the really cool story. Like, oh, you did go to the University of Alabama. There you go.
Yeah, my master's is from the University of Alabama.
And you're wearing the right colors?
My oldest daughter actually graduated from UA as well.
Wow. And you're wearing the colors as well.
That's especially for this day.
Fantastic. Tell us your story. Tell us how you got to DCH in Tuscaloosa.
No problem. I was a programmer by trade back in the early 90s, late 80s, early 90s. I switched over to healthcare in around 93, and I've been in healthcare IT ever since with a variety of roles, from anything from system administrator, network administrator, all the way up from director to CIO. Our journey has been throughout 4 different states. I've worked in hospitals ranging from 99 beds all the way up to our current 880 plus beds. So it's been a very diverse career, mostly all with MEDITECH as the EMR. But I mean, it's been a very unique journey, and it's one I'm passionate about, because once you see the impact you can have on the patients and the clinicians' lives by having the tools provided to them, it makes your career fulfilling.
Yeah, you and I are contemporaries. I came up in the 80s and 90s. I also started as a programmer. I'm curious, what was your first computer that you were programming on?
Commodore 64.
Me too. Wow, we really are contemporaries.
We're telling our age, Bill.
I know it is like carbon dating. You say what computer you started on and people know exactly where you're from. So you guys have invested a great deal of effort in really building up the organization and improving the healthcare that's provided for the community. So let's discuss a couple of things. Billy, I'd love to start with you. You guys were recently recognized for achieving CHIME's Most Wired Level 9. Tell me a little bit about that journey of doing that, and tell me a little bit about the importance of the recognition to the community.
Absolutely. When I first arrived on campus back in 2015, the only survey they had taken with CHIME, they received a most improved back in 2013. We did our first survey in 2016. We ended up being a level 5, which was a little bit of a disappointment to me, but it also set the baseline. So throughout the next year, we worked hard to get the improvements up and understand what the survey is really focusing on, and trying to guide our roadmap for our organization to align more with what other organizations were doing. The second year, we hit level 7. So we really made a lot of strides. We really did a lot of the automation they were looking for. And then as we progressed, each year I used that survey to help determine what our roadmap items are for the next year. It doesn't fully do the roadmap, but it helps us prepare to understand where the industry's going, where others are going, what they see as beneficial to the patients and the clinicians. So from an IT team standpoint, it solidifies and gives them the recognition that we are doing things correctly and we're keeping pace with other organizations. We also can affirm and reaffirm to our community, we are putting the right things in place to be that technology leader in the area to ensure they're getting the best possible care that we can provide with the tools we give our teams. So as far as the survey goes, we scored extremely high on several of the domains, scored really well on the remaining ones. We did see a gap on one of the domains that was new in the last couple of years, and that's around patient experience. So we've been reaching out with external vendors, looking at what we can do to enhance our market share into that side of things. And then this year, when we took the survey, it focused a lot more on patient experience and then started digging into the AI realm. So it gives us a little hint of where they're going in the future.
Yeah, I love those things like CHIME Most Wired and HIMSS Level 7 as organizing principles. Like you can organize and rally a team around those things and really make progress pretty quickly. Faith, I'd love to talk to you a little bit about, I know that your system has improved their Leapfrog hospital safety grade from a D in 2021 to a B in 2024. That's significant progress as well. DCH is, best in Western Alabama for quality and patient safety. Huge strides. Tell me a little bit about your work and the work of the organization that went into achieving these improvements. And, what has I guess the perspective is, what's the impact been on the system and for the patients in the community?
So when DCH first decided to data to the Leapfrog group, the goal was really about benchmarking ourselves against national safety and quality standards. And it gave us a way to see kind of where we stood, identify, areas of improvement, and just as importantly, show our community that we're committed to transparency and high quality patient care. And honestly, through this journey, the impact has been tremendous. Really, from a nursing standpoint, our staff retention has greatly improved over the past 2 years. And, our nurses, physicians, and staff, they really just want to be part of an organization where patients and patient safety comes first. So in our community, it's also very important. So to your point, back in 2022, 2 of our hospitals, both regional and Northport, were rated as a D. And that was it was a turning point for us, and it really reflected the challenges that we were facing at the time. So spring of 2024, things started to turn around. Hospitals moved up to a B, which was the first time in a couple of years that we had seen that kind of improvement. But getting there was not easy. We started with a multidisciplinary team that focused on some targeted initiatives. We included pharmacy, nursing, lab, quality, IT, and really evaluated areas where we didn't perform well in the past. So one of the early gaps we identified was barcode scanning. We did a deep dive in how scanning across the organization was being used, and we noticed there were some gaps. One of the first changes, which was an easy change with the help of Billy, was standardizing our scanners throughout the organization. Another thing we did with nursing is we met with nurses. We listened to the staff regarding what barriers they were having with barcode scanning. And some of those were simple as Wi-Fi dead zones or barcode readability. And so fixing some of those smaller issues really made a huge impact. And we were able to move our scanning compliance from about 85% to consistently being over 95%. And that was a huge leap in terms of patient safety.
As I listen to you talk about that, I'm wondering what the impact of going from D to B and all the changes and improvements had on culture and morale.
Yeah, I think it's had a huge impact. And I think that's reflected in our retention over the last 2 years. And so, as I referred to earlier, I think clinicians at heart, they just want to know they're taking the best care of their patients. And when an organization has that at their core, and that's their goals, and they're on a continuous improvement mission, I think that speaks volumes to changing the culture.
Yeah, absolutely. So I understand another goal for DCH is to really build out the business. And I'm sure your improved industry scores help in that effort. Give me a little bit more about what you're offering to the community in that effort. And Billy, Faith has just talked for a little bit, so we'll turn it over to you. Talk a little bit about the technical side of that.
Sure. So what we noticed was community providers have a hard time finding a good EMR for a good price. So when we did some market analysis and some market studies, we discussed with some internal staff what the possibility would be of hosting Expanse Ambulatory for these local clinics and what benefits it could provide. So what we ended up finding out in our analysis was some of our local clinicians were paying well into almost $10,000 a month for an EMR.
Wow.
Which is extremely expensive and hard on their operational side. We also found the lack of support for clinics in this area. People did not want to take on healthcare because of the reasoning of payments, things like that, that really affect this industry, and partnered and built a contract out to talk about how we could service the ambulatory EMR and sustain local clinicians. And what we came up with was a product that we can offer them that's very cost effective to any other system on the market, where we implement it, we build it. We have a secondary piece of that, that if the office has problems finding an IT vendor, I'll also offer IT hardware services as a contracted service as well. So we can provide their office equipment, do all the maintenance, support, network, build up the infrastructure, everything. All they're responsible for is a connection back to us, and we help them maintain that and help them tell what that is to carry the traffic load. So technically, we go in and we become a one-stop shop for this practice to have their EMR integrated directly into our Expanse system. So they're getting much more seamless view of the patient continuum of care. They see everything that happens real time, interface is all integrated. And then we also come behind that and offer them the office support that they need to keep the computers running, keep them safe, make sure we're monitoring everything, and then make sure they have the best platform possible to run their office as effectively as they can.
That's fantastic. I know that the burden on those individual practices can be overwhelming, not only from a cost standpoint, from a support standpoint. You know, who do you call when you have issues and those kinds of things? You need that healthcare expertise in order to do that. And that's not readily available in a lot of cases.
And most of the time, they're having to go outside of the city of Tuscaloosa to get it. For example, the clinic we actually provided the services for was having to contract with a company out of Birmingham, which is a little over an hour away. So when they would place a technical call, they had a minimum of an hour travel, an hour back that they're paying for, that there's no service being rendered.
Right.
We're less than 10 minutes away. So, you know, when they call us, we have a help desk that's available 24/7, 365. We can dispatch a technician on demand, and then we go take care of their services in real time for them.
So, Faith, give us an idea. I mean, we just heard about the technical side. Give us an idea on the clinical side, what this looks like.
So when we're rolling out a new system, we always start by going in and looking at their current workflows. We want to make sure that we have a good understanding of their current workflows and that they already have solid processes in place before we layer on any new technology. So once we establish their workflows, during the go live, we provide at the elbow support for around 2 weeks, depending on the clinic size. So that means we're right there with the staff, we're right there with the providers making adjustments on the. And then after that, we set up a dedicated support line for them. And we also round in that clinic regularly from an informatics standpoint, so they know there's always help close by and that they're supported. And then one of the things we do, you know, some of the workflows that we put in place for these clinics are, you know, MEDITECH standard practices, but others are more customized, tailored by their specialty or even by the individual practice. And that flexibility alone gives the providers a sense of autonomy whilst still keeping the care safe into the system. And we've had a lot of good feedback from the clinics. It's been really positive so far. Providers love that the workflows are seamless, so they can monitor their labs and radiology results in real time for their acute care patients, or also patients that are in their clinic right there in front of them. So they have those answers real time. So for them, I think it's made the experience much more efficient for their staff, and they feel more connected to their patients.
I guess I'll throw this question out right in the middle of the two of you. One of you can handle it, but what's next for DCH?
That's a loaded question, Bill. We are growing by leaps and bounds. And when I say growing, you know, at one point, Tuscaloosa was an oddity out there in the market today that most of the providers in the area were independent. We're seeing switch a little bit. Our new administration that came in 2 years ago has more of a appetite to start taking on this business line. And we're starting to see more and more clinics transition and want to become a part of, and we're extremely busy with that. But we're also looking at interoperability as a whole. We're right in the middle of implementing the Traverse product with Exchange. We also have a connection to our state HIE already. So this has been more of a global view of what our patients are doing once we get the Exchange connection installed so we can see other HIEs. And I think it's all about that continuum of care for the patient. And I know from a clinic standpoint, we just had 2 clinics go live the first couple of weeks of August, a large cardiology practice and a new care line of business for us for primary care. So this area is really underserved for primary care. So we stepped up and started filling the clinic to address that. And then I'll let Faith talk about our other venture that we have going on with our LTAC unit.
Yeah, so we have an LTAC that is housed in here. I guess it's a different business, but they are housed within our facility. And we are about to embark on implementing MEDITECH as a service. They are currently on paper, so this is going to be a big transition for them, but I think it's going to be monumental for them as well because, we provide them with lab and radiology services, so it's going to make their workflows seamless from that standpoint, as well as having their nurses on an electronic health record. So I think that's going to be really monumental for them. And then one other project that we're working on is we have partnered with MEDITECH to be an early adopter for Expanse Pathology. And I also think this is going to be really important for our providers, and they're really excited about it. So from a pathology standpoint, it's going to really streamline all of their workflows, both on their clinicians and the providers. And it's going to streamline everything, like from their findings, their diagnosing, slide management, documentation. All of that can be done within a single screen rather than navigating across multiple windows. So it's going to be much more efficient and really support better patient care in that respect too.
Yeah,
And a couple of other items as well. I know we haven't gotten too far into the project. We got a lot on our plates right now. Also starting vendor assessments for ambient AI to try to get into that model to see how we can help improve clinicians' workflow and reduce burnout, the things everybody commonly hears. And we're also, from a technology standpoint, we host everything internally from the hardware standpoint, but that technology and infrastructure is aging. It's time for us to do a reassessment. So we're actually looking at this point to see if going cloud-based with the hardware could be less intensive on staff internally and give us a better model going forward, more efficient, effective, and more effective.
Yeah, it's fantastic. I love the progress you guys have made. Love the direction it's going. One last question, and this is a real serious question, which is who's going to win the SEC football title this year?
Alabama Crimson Tide.
Faith, agree with that? No comment.
Yes, I'm always hopeful for Auburn, but we have struggled the last several years. So I think I'm more optimistic that Alabama may be there than Auburn.
Hope springs eternal at the beginning of a season for sure. So yeah, it's amazing. And whoever wins the SEC is likely going to win the national championship. So it should be fun. Hey, thank you for coming on the show and sharing the great progress that is going on at DCH.
Thank you for having us, Bill.
Appreciate it, Bill. It's been an excellent journey for us.
Thanks for joining us for this executive interview with me, Bill Russell. Every healthcare leader needs a community they can lean on and learn from. Subscribe at thisweekhealth.com/subscribe and share this conversation with your team. Together, we're transforming healthcare. Thanks for listening. That's all for now.